Collaboration and Care. Introduction. With the current trends toward telehealth for reasons of convenience, COVID restrictions, or pure necessity, remote collaboration is quickly becoming commonplace and even welcome in healthcare. Zaire et al. 2020. For Caitlin, an infant with newly diagnosed cystic fibrosis, successful remote collaboration between several disciplines may literally mean the difference between life and death. Evidence-based care plan. Caitlin's specific care plan will center on maximizing her nutritional status to increase her overall chances of survival and longevity of life. According to Hollander et al. 2017, since optimal nutrition is paramount to survival in cystic fibrosis patients, it stands to reason that this care issue would be on the front line of defense against cystic fibrosis. In our scenario, Caitlin is under 2 years of age. The following care plan was developed for Caitlin. Number 1, imbalanced nutrition, less than body requirements, and number 2, knowledge deficit. The care plan is initiated upon admission and its timeline runs through discharge. Since Caitlin lives with her mother and primary caregiver Janice in another town than the hospital that's treating her, remote collaboration is necessary. Caitlin's primary care pediatrician also lives some distance from the hospital. To improve upon this care plan, it would be beneficial to know Caitlin's feeding status, such as her favorite foods, preferred textures, if her chewing and swallowing is compromised in any way, her routine eating patterns, etc. It would also be beneficial for the care plan coordinator to ascertain the readiness to learn of Janice, Caitlin's primary caregiver, since a plethora of new information will be delivered quickly. One could also find out Janice's preferred method of learning, whether visual, written, etc., to assist her in processing the new information. How an evidence-based practice model was utilized in creation of the care plan. Promoting action on research implementation in health services, or PARIHS framework, was utilized in the creation of the care plan due to several points obviously being important considerations in the care plan. Since the implementation of this framework is outlined, since the implementation of the care plan will take place on the unit where Caitlin is, the context or second element of this framework is outlined. The evidence will be cited to follow in the assessment. The last step of this framework, facilitation, will be especially interdisciplinary in Caitlin's case, due partially to her age and partially to the dynamics of her diagnosis of cystic fibrosis. White, 2017. Sources of evidence. The article entitled "The Optimal Approach to Nutrition and Cystic Fibrosis, Latest Evidence and Recommendations" by Hollander et al. 2017 was relevant and useful in determining the care plan for Caitlin. The article is found in a peer-reviewed scientific journal, Current Opinion in Pulmonary Medicine. The journal, established in 1995, is a highly regarded journal in medicine. Although an unrelated advertisement does appear on the web page containing the article, it is unclear whether it belongs to the journal or the Ovid site where the article was discovered. There is no request for donations on the page, and the 3 authors noted on the article are credentialed professionals who preside over various programs at healthcare facilities. Benefits and strategies to mitigate interdisciplinary team challenges. One strategy of interdisciplinary collaboration in this day and age of technology, of course, is utilizing telehealth services. For our purposes, we're going to assume that Caitlin is covered under Medicaid. Since most states have little or no red tape concerning reimbursement, for telehealth services. This is ideal for Caitlin and her mother Janice, who live in another town from the hospital. Gov 2020. Follow-up appointments at Caitlin's primary care physician can even be done remotely. If need be, the hospital can use the telehealth to determine if Caitlin's mother needs to bring her to the hospital in the event of exacerbation of her cystic fibrosis. The main benefit of the telehealth services is to avoid possible close contact with infections or illnesses carried by others encountered in a brick-and-mortar doctor's office. There are also the monetary benefits such as saving on fuel and food expense, meals to work, etc. In future situations, a platform such as Zoom could be utilized for patients as complicated as Caitlin. This would improve patient outcomes because everyone on the interdisciplinary team would be given the same information at the same time and have the opportunity to consult with the colleagues on the case in real time. In conclusion, with the daily advancements in technology, interdisciplinary teams run more efficiently and less cumbersome than in the past. Not only are patients experiencing better outcomes from being able to be managed effortlessly by several collaborating caregivers, they are able to spend time resting and healing that would otherwise be spent traveling and waiting to see doctors.